Hello everyone. This is the third topic of our pediatric revision series, and this topic is maple syrup urine disease, which is an important biochemical disease, and the questions are frequently asked in exams like NEET, PG, or PDCET. We are targeting PDCET aspirants because exam is next month only. So we will go through this topic firstly. What is the basic concept behind this? So the basic concept is that the defect in enzyme for any biochemical disease, we should remember the enzyme defect. So enzyme is branch chain alpha keto acid dehydrogenase complex. So this enzyme is defective, which one? Branch chain alpha keto acid dehydrogenase complex. And what it leads to accumulation of leucine. Leucine is the most toxic compound which is accumulated in the body because of this enzyme defect, and other is isoleucine and valine. So leucine is the important one which you should remember, that it leads to accumulation of leucine and which leads to toxicity. And these are broadly known as branch chain amino acids. So usually it's asked that maple syrup urine disease, so branch chain amino acid defect. Okay. So what we have to remember from this slide, enzyme defect is branch chain amino acid. At least you should remember this term. And to be precise, branch chain alpha keto acid dehydrogenase complex defect, and it leads to accumulation of leucine. Leucine is the important compound which leads to toxicity. Genetics, it is autosomal recessive inheritance, so consanguinity is other important point for this disease. And case history, if given in MCQ question, then you should remember. So autosomal recessive mode of inheritance. Now coming on to the pathophysiology, the failure to metabolize branch chain amino acids because of the defect in enzyme leads to accumulation in blood and brain, and accumulation of the neurotoxic substance leucine. So leucine is the important neurotoxic substance which is getting accumulated, is leading to neurotoxicity. And what effects are there and how it affects the brain? It leads to cerebral edema, neurodegeneration, and metabolic encephalopathy. Okay. Now, clinical features, classic presentation, which is usually seen in the neonatal period. Patient is usually normal at birth, and symptoms starts after 2 to 5 days. So, question can be framed like this: that a healthy newborn at the fifth day of life presented with so-so complaints. So, normal at birth, but symptoms start after 2 to 5 days of life. Characteristic finding is urine smells like maple syrup or burnt sugar. So the name is maple syrup urine disease. The urine of the patient smells like maple syrup or burnt sugar. Features, clinical features of maple syrup urine disease: poor feeding, vomiting, recurrent or multiple vomitings, lethargy, hypotonia, and later it leads to hypotonia, but initially hypotonia. So it comes in the differential diagnosis of floppy neonate or floppy infant, we can say. Okay. So the child is floppy, hypotonic, seizures can be there, and comatose condition can be there. So poor feeding, vomiting, lethargy, hypotonia, seizures, and coma. These are the clinical features of maple syrup urine disease. But these are usually common clinical features of any metabolic disease in newborn. So what are the characteristic finding? Urine smells like maple syrup or burnt sugar. Now types of maple syrup urine disease. The first one is classic variety. It's very severe and neonatal onset. Intermediate variety is moderate and a little bit later onset. Intermittent, only stress-induced episodes are there. During exertion or stress, the symptoms may appear. And thiamine responsive improves with thiamine. So these are the four varieties of maple syrup urine disease. Now, how to diagnose this disease? Newborn screening with tandem mass spectroscopy is the mode of screening for this disease or any other biochemical disease. Lab findings. What lab findings? As we have seen, leucine is the most toxic compound. It is important when it is accumulated. So, increase of leucine level can be seen. Increase isoleucine valine or increase keto acids. And what is the pathognomic feature? Allo-isoleucine is present. So, allo-isoleucine, this can be an important MCQ. Pathognomic feature of maple syrup urine disease, so presence of allo-isoleucine. Metabolic findings. What are the metabolic findings? Metabolic acidosis and ketonuria are seen in this syndrome, and MRI may present with cerebral edema in the acute phase of the illness. Now, differential diagnosis: urea cycle disorder, organic acidemias, neonatal sepsis, hypoxic ischemic encephalopathy. These also presents with dull, lethargic, poor feeding child, an hypotonic child initially. Urea cycle disorders, organic acidemia, these may also present with lethargic, poor feeding, and recurrent vomiting episodes, and failure to thrive. Okay, so these are the important differential diagnosis of maple syrup urine disease. How to treat this illness? Acute management. Management is stop protein intake. High calorie glucose infusion should be given. Dialysis if severe toxin accumulation and renal impairment, and acidosis to be corrected. In severe acidosis also, dialysis is recommended. So this is the acute management and long-term management. How to maintain this child? So restrict branched chain amino acids in diet with we should avoid branched chain amino acids in the diet of this child. Special formulas with low leucine available in market. We have to use that, and thymine is used in case of, we have seen the fourth variety, thymine responsive maple syrup urine disease. So we should try thymine in those cases. Complications, we have already seen brain damage, like encephalopathy, cerebral edema, and neurodegeneration. These are all the consequences of this syndrome. Developmental delay definitely because of all these things, and death if left untreated. So high yield points, high yield, I should say, high yield MCQ points basically. So maple syrup urine disease, defect in branch chain amino acid deficiency, accumulation of leucine, we have seen the most toxic compound, urine order, this is specific for maple syrup burnt sugar, diagnostic marker, allo-isoleucine, we have read in previous slide, hallmark for maple syrup urine disease is allo-isoleucine, inheritance, we can remember easily autosomal recessive, and treatment is diet restriction of branch chain amino acids. So this was in short about maple syrup urine disease, and one MCQ can be easily asked from this syndrome. So thank you for listening, and you can subscribe to this channel for more videos in upcoming days, especially about PDC 82